what changes do you see coming in the next 5 to 10 years in regenerative medicine? And, there's obviously a lot of, FDA cracking down on stem cells type thing, not because they've hurt anyone, but because, the politics behind it. Can you speak to that a bit?
I wish I had a crystal ball and can tell you where things were going. I'm a big believer in the body's ability to heal, and that we have the things inside us that can help us heal in ratios that I think are important. And so where I hope the field doesn't go is where we move to kind of what we're seeing outside the US, which is where, okay, in a vial, you can get 100 million mesenchymal stem cells and you can inject that in, and that's going to do X, Y, or Z. I hope it doesn't move to that, because there are so many things that are present in bone marrow and adipose tissue, more than just the mesenchymal stem cells and the hematopoietic stem cells. There's growth factors, there's cytokines, there's proteins, there's peptides. There's all these fantastic things that can help tissue healing in one way or another. Now, I will say there does seem to be some emerging evidence out of Europe that once you hit a certain number of stem cells in an injection, these are stem cells from a vial, mesenchymal stem cells, where they're taken from a donor, they're grown in a lab, they're expanded, and now you have the ability to inject 20 to 300 million of these things. There does appear to be some true tissue regeneration in things like the Achilles tendon. I may change my opinion if we can see that, hey, the ability to do that is actually better and safe in a patient. I think where I'll get more comfortable with that, which I think is going to be really cool, is if we can take stem cells from a patient and then they can expand those in the lab. So, Dr. Tim, we could take your bone marrow, it goes off to a lab, they expand out your stem cells such that you can come back in, and when your knee's bugging you when you're 82, we can put 100 million stem cells inside your knee, and that gives you pain relief for 10 years. And maybe it helps delay the progression of your arthritis or reverses at that point, who knows. But I personally like when my stuff gets put back into me, and when I take stuff from patients and put it back into them, a little bit more than, having something off the shelf. Where's it all going to go? I don't know. Sadly, it really depends on who lobbies the most, who throws the most money at it. And who's going to do it? The biopharmaceutical companies.